Good morning, I am Dr. Maheshwari, fertility consultant from Oasis Fertility, Ananagar, Chennai. In this video, we just see about the importance of fallopian tube for fertility. So, fallopian tube, there are two fallopian tubes arising from the uterus and it goes near the ovary. So, this fallopian tube is normally 10 centimeter in length and it is a thin caliber of opening inside, and normally it has a 4 parts. Like intramural part, then intramural, the first thing which is inside the uterus, and the second part is isthmus, and third part is ampulla, and which ends in the infundibulum, and infundibulum opens out in the fimbria. Fimbria is the opened out portion of the tube on the ovarian end, and here the intramural part, there is a opening where it opens into the uterus. So normally initially the sperm as well as the egg interaction happens in the tubes only, fallopian tube. It is in the ampulla of the fallopian tube, and in the inner portion of the fallopian tube there is a small hair-like structures called cilia, which has the propulsive motility, which brings about the fertilized or the egg and sperm meets at the ampulla, from where it comes to the uterus by means of the ciliary propulsive movements. So for a normal fertilization, a normal embryo transfer to the uterus happens via the tube. So for which the tube should be healthier. There are many conditions which can cause damage to the tubes. For example, there could be infections in the tubes by means of any kind of any bacterial infection or tuberculosis, where it can cause a tubal infection we said to be the salpingitis, and this can cause the swollen and inflamed tubes. In such case, the tubal function will be impaired. That is one thing. And second thing, the tubal motility can also be impaired by means of this, and this can result in the adhesions as well as shrinkage of the tube, as well as it causes a tubal blockade. So when the tube is affected by means of infection or blockade or something like that, there could be more chances for infertility. So here comes the tubal testing. The tubal testing can be done by means of testing called HSD, hysterosalpingogram, or else by means of a SSD. These two are the most simple tests, and SSD is said to be a saline sonohysterography. So in case of HSD, what we do is we instill a dye into the uterine cavity and we observe the uterine cavity as well as whether the dye is coming out of the tubes. And if everything, the caliber, everything, if it is fine, then we can assume it to be a normal tubes. In case of any tubal blockade, the tubes won't be visible. So in such way, we can pick up any problems inside the cavity also, any abnormality in the uterus or any presence of polyp can be identified by means of this, or else any tubal obstruction at the end of and the site of obstruction can also be revealed by means of the HSD. So if you are not planning for this two kind of testing, we can go ahead with the laparoscopy, where we can inject a dye into it and we can identify the tubal patency. So these are the simple tests by means we can identify the tubal things. And in case of a tubal block like bilateral tubal block, or in case of a tubal swollen like hydrosalpinx and all, better to go ahead with IVF, because tubes are the main important one for the fertility to occur. So because the initial sperm and egg interaction happens only in the ampullary part of the fallopian tube. Once it gets affected, the chances for fertility is more. Thank you so much.